If you've ever had it, and I mean really had it, even once, you'll never want it again. Hi, I'm Roger Follebout. Welcome to LifeWorks PRMC. Great to be back with you again, and on today's program, we're going to be talking about, of course, the flu. And I mean the real nasty, knock you down, put you on the couch, every joint in your body can't keep a thing down flu. But is it inevitable that you're going to catch it? And is there anything we can do to prevent it? On the program with us today is Dr. Chris Snyder from Peninsula Regional Medical Center. He's a hospitalist and our Chief Informatics Officer. Chris, welcome to the show.
Thank you,
Good to have you with us.
Good to be here.
So, what is the flu?
So the flu, everybody loves the flu. It's called Haemophilus influenza. It's actually a virus. So there's a bunch of different strains of the viruses, and that's why it's so challenging. A lot of people don't understand viruses are one of those things that genetically are very hard to treat because of the way they offspring and spore. So there's challenges we have with viruses, and the flu is one of those very challenging things that continually evolves as we get through the courses of care, and the challenges with it is it's something that everybody can get no matter what age. So
yeah, as I said at the beginning of the show, if you've ever had it, and I mean really had it, it's miserable. So what makes this such a nasty virus?
Yeah, it's again, a virus is the holder of the virus is the key. So the sicker the patient, the younger the patient, the older the patient, these viruses do get very nasty. Folks with normal immune responses, normal immune system, the immune system is basically the way your body protects itself from the environment. So the host is the key. So again, the nasty viruses typically come into hosts. So if you have another illness and you've developed the flu bug, that's where it's very, very dangerous and actually life-threatening in many cases. So it is a nasty bug. The common individual who has a healthy environment, eats well, exercises regularly, should do fine with dealing with the flu symptoms, anywhere from a 3 to 10-day course. But it's the folks who tend to have a secondary infection or other disease, underlying chronic disease, that get in trouble with this.
And often what we think is the flu turns out not to be the flu. Is that right?
Yeah, well, everybody gives the flu a bad name. Unfortunately, there's 1,000 viruses out there, so flu is what it is. It is one of many viruses. The strains that we typically see are influenza A. There's an influenza B type also that's out there, and the A and the B isn't categorized other than by a microbiologist, so it's nothing significant for the common day person to worry about, but the flu is the flu. So we label everything the flu, unfortunately, even when you get the flu shot.
Yeah, and you know, and I don't want to make light of this too, because a lot of people can and will die from the flu this year in the U.S.
Yeah, and you know, it's interesting. Anywhere from 3,000 to 4,000 to up to 50,000 in 2009 can have died from this on an annual basis. So it's real. Again, it depends on the host of the virus, whoever gets the virus. It's the underlying pathology that person has to fight off that illness. That's the challenge. But yeah, it can be extremely dangerous if not treated.
So those with already compromised immune systems are really at risk for getting it.
Oh,
much worse than the rest of us, right?
Absolutely. Under the young children and the older adults, over 65 population with illnesses, cancer, pneumonia, diabetes, emphysema, COPD. There's a number of different illnesses. Any cardiovascular diseases, again, all put you at risk for this. Not sure why those folks are more at risk, other than the immune system just, again, is not responding appropriate to protect them.
Sure. So what can we do, Chris? I mean, is it inevitable that, you know, we're going to catch the flu, or what can we do to protect ourselves from it?
Yeah, everybody gets exposed, unfortunately. There's some, the flu shot is obviously number one. Getting that flu shot really does have an impact on the way you respond to it. So, and basically the flu shot in a nutshell, it builds your system up to be accountable for when that virus does get into your system. It teaches the immune system with a very small dose of the virus that's injected into your inhaled nasally, and it teaches the body to fight that. So it's basically, it builds an army for you. So it does help. It doesn't, again, eliminate the fact that if you do get exposed to flu, you may still get the flu, but hopefully it'll lesser the symptoms. And that's one of the key things people don't realize. That flu shot is really very protective. Probably one of the other bigger things that we can look at is washing your hands. Hand hygiene is huge. Again, I love seeing my kids with you go to their schools and elementary schools and all the teachers got their little squirt bottle. That's very important, and we can go through that more in detail if you want.
Yeah, I do. I want to talk about hand hygiene in a little bit, but let me also circle back around to the fact that we're taping this show in November. Is it too late now to get a flu shot? And what is the traditional cutoff point to do that?
So flu season starts October 1st, and it usually runs through May. So during that time frame, anytime prior to October 1st, usually in September time frame, it takes about 2 weeks for your body to respond to the vaccine. So once you've been given the killed virus that's in the vaccine, your body builds an immune response, and it takes about 2 weeks for it to learn how to attack that bug. So again, you got to give yourself a little time frame. You could get exposed during the two-week window. You can also get exposed after and obviously before. So the sooner in the flu season, the better. Is it too late? No, absolutely. Because again, you have a 2-week window. So if you get January 1st and you've not had flu exposure, getting that injection is fine. So it still protects you for that springtime and wintertime.
Gotcha. What kind of protection will it provide? You touched a little bit on that earlier, but I want to circle back around and talk about that a bit more too.
So the protection it gives you, basically the immune response that it gives you.
Yeah.
So that focus is it builds up your white blood cells and it teaches them to attack this virus, which is very interesting. There's different kinds of immunizations out there. So a lot of people hear about the vaccine, they hear about the nasal sprays. There's different age groups too, and typically it's not FDA recommended for under 2 years of age. And then there's also a big dose or a super dose of flu that you can get out over age 65 if you have asthma or diabetes. So there's a number of different vaccination properties. Anywhere from the younger group also can get a nasal spray, which is a live vaccine, except for healthcare providers. So getting those vaccines really does drive your immune system up, and it really does give you that rapid response so you can self-mediate. Again, there is no antibiotic for a virus. Viruses, there are some other agents that we use that actually help suppress or decrease the amount of virus that's built in the body. And like I said earlier in the beginning, it's kind of cool how these viruses work. They actually mutate and they modify themselves to survive. They're animals, so they live in our system. As they survive and develop more immunity, we call it, then we have to change therapy. That's done through cellular structure, and that DNA replication can be suppressed or reduced by using these other medications that are on the market. Those market medications are antiviral agents. They don't kill the virus, they just prevent it from getting worse. So they prevent it replicating and becoming more defined in the body.
Sure, and since that virus is in all of us, is the flu shot recommended then for people of all ages? You mentioned that young kids can have the spray. Mm-hmm. You mentioned that there's the super dose for older individuals.
Right.
Just about anybody can have a flu shot, correct?
Absolutely, and the sooner you get it in the season, the better off you are. That immunity will last for the whole season. You only have to have one injection, which is great. And again, the nasal spray is fine for those folks who are not healthcare providers. Healthcare providers need to get the shots.
I want you to do a little myth busting for me here, Dr. Snyder, because I hear people say it every year. I'm not getting the flu shot because the flu shot makes me sick.
Yeah, so is it the cart before the horse?
Yeah.
So the challenges with flu is you can get exposed. If it's rampant in the community and you get a flu shot and it's within that 2-week proliferation period where you're developing immunity to it, you could absolutely get the flu. Now, that being said, you could also reduce the amount of response that you might get from the body. So again, suppressing your immune system is a good thing from this specific type of virus. And again, it depends on when your exposure is. So can you get a flu-type syndrome associated with the flu vaccine? Yeah, your immune system can make you feel kind of how the dwindles, but it's again a killed virus. It's not a live virus. It's not going to mutate and create a active flu scenario.
Mm-hmm. Let me ask you this. So we didn't listen to what you told us. We got the flu. I know it's not curable, but what can we do to at least manage it? We got to ride it out. So what can we do to make it at least tolerable?
Yeah, so again, the 3-day window is always a good window. Some people don't have fever with it. Some people have upper respiratory symptoms with it only. Some people have just earaches with it. Some people get the GI symptoms with it too, so which is kind of unusual, but it does happen. So again, depending on what the symptoms are, that's what we focus on. So if somebody comes in and they got cough, cold symptoms, yes, absolutely, we'll focus on keeping the mucus thinned, plenty of hydration, keeping the fevers down, and avoiding avoiding contacts with other folks. Those are the key elements. Hand washing is huge so you don't transmit it to everybody else in the family.
Let's get back to that too, because I know one of the things that we can't get on a big enough soapbox and preach at the hospital is proper hand hygiene. So take a couple of minutes to tell us about that and what we ought to be doing.
Yeah, so the alcohol scrubs are great for viruses. They work wonderful, and those are your common dispensers, alcohol dispensers. Great stuff. Soap and water, hot soap and water is probably the best thing. And whether you're a healthcare provider or you're a teacher or somebody at home, you need to encourage the young to do it also, because they tend to forget. And those are our little friends who spread things everywhere. God love kids. But they tend to bring those viruses around,
Yes,
and they tend to not wash their hands real well either, so their hygiene's not usually as good as far as that goes. But hand scrubbing is really important. Getting a good 15, 20-second, 30-second scrub of your hands, whether it's, again, with the alcohol scrub covering the whole hand, the fingertips, keeping your nails clean, and then also utilizing hot soap and water is probably the ultimate way to go.
Yeah, what is the proper technique? How should we be sanitizing our hands?
So yeah, we teach a lot of the happy birthday technique. So you sing happy birthday twice, and that should be long enough, washing or scrubbing your hands. Again, you got to realize the soap is only part of it. The actual massage process of going around and rubbing your hand in between your fingers are the key elements. That massage helps break the virus off and the bacteria off of your hands, and then it washes away in the suds of the soap or in the alcohol. If you're using that, the alcohol will actually kill the bacteria as you separate it from the skin. But that massage is very important, that friction that you get in your hands. So don't be afraid. Get aggressive with hand soaping. There's nothing wrong with that. And again, I love to see people wash their hands. The quick wash in the bathroom is not going to cut it. You got to get your hands wet. You got to soap them up, and you got to scrub them.
Let's talk about the importance too of, now that you've washed your hands, you're in a public restroom, let's say you've washed your hands, grabbing that dirty and potentially dirty door handle on the way out of the bathroom.
Sure. Yeah, so typically we grab a towel after, and you know it's the really dirty thing, which is amazing, and you find this, but grabbing the towel after you've dried your hands off before you turn off the faucet. So you find the faucet's probably one of the dirtiest things there, so closing that and using the hand towel that you just dried your hands off with to turn the faucet off is probably a great technique. You can also use that on the door handle too. You know, again, you're an animal in an environment. These viruses are everywhere. The more you do, as far as hand hygiene, the better. But there is still the aerosolization where you actually can sneeze it, cough it, and the saliva exchange between just common conversation is also a way you can get it.
Sure. Talk a little bit, if you will, before we get out of the program here, about visiting people in, say, hospitals, nursing homes, college dormitories during the flu season, and how important it is to protect yourselves and others in those high traffic areas.
Yeah, it's masking in hospitals is key. So if you're sick, first of all, please, we love your loved ones. We love you to visit them. Call them on the phone. Yeah. You know, if you're sick, you really need to avoid that. That's the population that dies from this. So the folks who are sick in the hospital, healthcare providers, and we push a lot at PRMC. Everybody, all the providers get vaccinated. We all get vaccinated early in the season. All the staff get vaccinated. It's so important to have that vaccine done early in the stay. But as far as if you're going to be visiting, please wear a mask if you do come in. If you have any sense that you have a bug, wear a mask, wash your hands well, use the gowning privileges. Same thing in dorms. Anywhere there's a large population, common conversation, handshaking, are all things. You know, avoid touching your face, avoid touching your mouth, your nose, your eyes. Rubbing your eyes is one of the easiest ways to get a virus into your system so it can replicate. So if you think of those things, just be more conscious about your hands. You know, we always say in healthcare that hands save and hands can kill also, because hands are a very dirty component. In fact, we usually don't touch people with our feet. It's usually our hands. So,
yeah, that's true.
So you always got to remember that.
Good advice and good points. If there's one takeaway, Chris, from this program that you want everyone watching to remember about the flu, what would that be? Vaccinate
early. Absolutely. Get everybody vaccinated. And if you have questions, there's great websites. The CDC is wonderful. Center for Disease Control is a great patient information out there to allow you to understand what type of vaccine you're best for. And obviously, call your healthcare provider. Get in there. Get the vaccines. You know, there's drive-through clinics everywhere. There's doctors' offices, CVS, you name it, pharmacies. There's a lot of places where you can get access to it. So take the time. It's a quick shot, and And the likelihood that you'll have any side effect from it is very, very low. There are side effects, but they are rare. And the side effect from the flu is much greater of a risk.
Yeah, absolutely. Well, Chris, thanks very much for being on the program today.
Sure, thank you.
Sharing some information about the flu with us. And if you'd like some additional information about the flu and preventing the flu, as Chris mentioned, there are plenty of great websites out there, including the Centers for Disease Control. Check that out. You can certainly stop by our website at peninsula.org. We've got some information there under our Adam Health content that will provide you some terrific knowledge about the flu and what you can do to stay even healthier this year than you have been in years past. And that's going to do it for our program today. We're so glad you joined us. As always, we're looking for terrific ideas for LifeWorks PRMC. If you have any, I'd love to hear from you. You can always email me at roger.follebout@peninsula.org, or you can give me a call at the office at the hospital at 410-543-7142. So until we see you again, take care of yourselves. Thanks to everyone here at PAC 14 for having us in. And remember, get vaccinated against the flu. We'll see you again soon.